Okay, so this next section of the posture lecture is going to be about taking a history and what some of the things that we see that will come up during a history or during your overall eval that are going to really kind of clue you in that it's a postural problem. There are certain answers that you're going to get to questions that are going to help clue you in that it's not really an acute injury, but that the underlying issue is because of a postural problem and not something else. So when we take our history, obviously the primary goal is to figure out what the mechanism of injury is. If a posture problem is related, then generally speaking, the mechanism is going to be insidious. We're not going to have any idea. When the person comes in and you say, what happened? They're going to say, I have no idea. Over the past couple years, over the past couple of months, over the past couple of weeks, things have been getting a lot worse. But I didn't do anything that I remember to really cause the problem. They're not going to know. And that is a classic posture answer. So you can rule out all acute injuries if you think it's linked to posture. But we still want to figure out what has caused it. A lot of times people will have poor posture and they're going to not really come in with any kind of problems. And they might have had bad posture for years and years, and then they took up a new activity, a new repetitive activity, and now that poor posture plus the activity has now led to an injury. So we're looking at generally overuse injuries that really have no mechanism injury and are oftentimes linked to new activities. Because we don't have anything that's very very specific in mechanism of injury, we tend not to have anything that's point tender. So we have the insidious onset with no mechanism of injury, but we really also don't have a very specific location of pain. So all those kind of things are going to, again, point you to a posture-related problem. Although the initial injury could be diagnosed as shoulder impingement syndrome, the underlying cause could be caused by postural problems. A lot of common responses that you're going to get that are going to help give you like the light bulb to postural issues is, like I said, insidious onset of pain. A big one is pain worsening as the day goes on. We've talked about this a little bit before, but a lot of times when you are lying down, when you're sleeping, you're able to kind of reset your body. You're not in a non-weight bearing position. It really kind of relieves a lot of the stress to your shoulders, to your back, to your neck, to your legs, because you are lying down, you're not standing. So in the morning when you wake up, you tend to feel pretty good. You're not really all that achy. As the day goes on and you're in that bad posture, whether it's seated at your desk or the truck you're driving or standing, whatever it is, you're in that bad posture, and as the day goes on, now you're going to start being worn down, and now you're going to start having a lot more pain. So we tend to see pain a lot worse in the evening than we do in the morning. They're going to give you very specific kind of details about postural pain. Kind of give you the story. Well, it doesn't feel that bad in the morning, but as the day goes on, I start to have a lot of pain. It's not very point tender. It's just kind of vague and generalized type pain. That's a perfect description. It's not always constant. A lot of times it is intermittent. Sometimes you can find comfortable positions and you can get out of it. Sometimes it's there all the time. It really just kind of depends on what the injury actually is. But generally you're also going to hear something where it started off annoying, a little ache, and over time has gotten a lot worse, and now I can't even whatever. So these are responses that you're going to get that are, again, going to help clue you in that the cause of the problem is really related to posture. Because this is a chronic condition with an insidious onset, we need to ask a lot of questions. This is where those categories come in. A lot of questions about pain. There's always a lot of questions about pain, but we want a good description of what actually is going on here. So when is the pain the worst? Try to get that idea. We want to see that is it in the morning, is it at night? The day goes on, because if we see a lot of night pain or a lot of morning pain, then it might not be linked to posture. It might be linked to something else. What type of pain is it? Burning, sharp, aching, pulsating, paresthesia, constant, intermittent, does it radiate? All these things are going to be really important, especially all those neurological ones. Normally speaking, posture pain that is not related to nerves tends to be dull, achy pain. Maybe sometimes sharp if you move a certain way. Maybe sometimes burning, but it's more of an achy type thing. when you start to get things like burning, pulsating, radiating, paresthesia, those kind of things are going to help clue you in that it could be posture, but also could be neurological. And that's going to have, you're going to have to pay a lot more attention when there is neurological problems. Usually when nerves are involved, it's a lot bigger problem, and you really need to address it quickly. The person is usually in a lot more pain, has a lot more disability when there is nerves involved versus just a general muscle ache or joint ache that they experience when they just have regular posture-related pain. So getting what makes it better, what makes it worse, and the type of pain that it is. Kind of a side note here, when you are looking at someone, you want to ask them what is their dominant arm specifically, because what we tend to see is whatever your dominant side is, specifically in the upper extremity, your dominant shoulder, that side tends to actually sit a little bit lower. So when you're looking at someone and they say they're right-handed, and you look at them and you're like, well, their shoulders aren't level, you want to ask them, what hand are you? What hand do you use? And if they say right side, even though that right side shoulder is lower, it's not necessarily strange. In most people, the dominant side shoulder will actually sit lower than the non-dominant side. And I've tried to look this up and try to get an explanation, and there really isn't anything great. All I can really think about is, although there is usually more muscle tone on the dominant side, there is also usually more range of motion on the dominant side. So there's a possibility that the muscles have a little bit different makeup than the non-dominant side. Maybe there's a little bit more range of motion, less bulk, but really that's all I can kind of think about. But needless to say, it is not unusual if you find that the dominant shoulder is lower than the non-dominant. More questions to ask. How does this posture problem relate to your activities of daily living? And so what does it interrupt? But also, what do you do? You need to ask a lot of questions about what the person does. What are their normal activities of daily living? What is their job? Is it a truck driver, bus driver? Are you a factory worker? Are you at your desk all day? Are you on your feet all day? Do you lift things? All these different types of jobs are going to have their own posture-related issues that you're going to have to know about. This is where you got to ask a ton of questions to try to come down to the right answer. If you don't have any idea what they're doing or what they're talking about, have them demonstrate. What can you show me what you do at work? Can you show me what you do that really tends to aggravate the pain? If you don't know something, you need to ask. Even in athletics, there are plenty of sports that I'm not familiar with, and there are plenty of small, subtle things that happen in athletics that I'm not sure about. For example, I know a fair amount about football, but I don't have any idea the intricate moves that linemen do to each other to get past each other. There are different hand techniques and feet techniques and whatever it is that is common knowledge to them, but I have no idea about. So if I don't know about it, I'm going to ask, and I'm going to say, can you please demonstrate that so I can see what you have to do every time. So don't be afraid to ask for clarification. You also can ask, has anything changed recently? And did you get a new job? Did you get moved from the line, down to somewhere else? Are you doing something different? And that may have triggered why you have this postural pain right now. Has anything changed? So there we go. Anything changed over the last few months? It could be everything from change in jobs, change in car, change in sleeping arrangements. Maybe you got kicked out of the bed, you're sleeping on the couch now. Maybe you got a new mattress and it's not working for you. Whatever it is, are those driving, sitting, sleeping postures, have they changed? Those are the things that these specifically are usually positions you're in for an extended period of time. So if you have changed something recently, you may start to see it because you're in it for so long. Or even if you've gone from a sitting job to a standing job, that can really affect things. So you just need to know that what they've changed, just like we ask our traditional athletes, what have you changed recently? Well, I started running, 3 times as much as I used to. Well, that's an important piece of information. So what has changed in their normal life that may have been linked to this postural problem? Same questions. Do you exercise? Is it regular or is it sporadic? Maybe you've done too much too quickly, and maybe you, like I talked about before, you might have already had poor posture, but you didn't really do anything, so you didn't really notice the problem. But the example I always give is forward shoulder posture, because it is very much linked to upper extremity injury, shoulder injury. So you say you're a 20-something-year-old, you're not that athletic, you don't play many sports, you don't participate in much, you have forward shoulder posture. And now you're going out and you're playing volleyball 4 nights a week with your buddies. That's a lot of overhead activity, a lot of power involved in those activities. So you still have forward shoulder posture because you never addressed the issue. And now you're doing an upper extremity shoulder related sport with forward shoulder posture. So that change alone can possibly be linked to why you have this shoulder problem or this postural pain problem. Just because you did something that you're not used to doing, something that could possibly have triggered the problem. The actual inspection here, try to, again, tell the person that you're doing a postural eval, but there's a good chance when you start to stare at them, they're going to figure it out. So they are going to know about it. You want them to be as comfortable as possible. So you want to try to have them in a private area. If you have a side office, you want them, you're going to be working with them. You don't want everybody else in the athletic training room also staring at them. Part of that is because you also don't want them wearing too many clothes. I know it kind of sounds weird, but you have to be able to see what you're looking at. You need to see bony prominences. You need to see muscle tone. You need to see all that as close as possible. So wearing too many clothes is not going to work out. So if you have a male, try to have him in shorts only. If they're not comfortable with that, wear shorts and a tight tank top. Females, shorts. Shorts and a sports bra would be best. If they're not willing to do that, shorts and some sort of tank top that will expose their shoulders. You need to be able to see those things. So do be careful, of having them too exposed. But at the same time, as a professional, you also have to be careful of being behind closed doors with another person. So I know, again, that's a kind of a weird thing, and you can be totally innocent. But especially amongst non-adults, among high school kids, you still want to make sure that maybe you pull them aside, you go to a private area, but the door is still open so that people know that nothing is going on. These are the things that you always have to keep in the back of your head. Whatever you're thinking is totally innocent, when you're dealing with someone, especially a child, make sure that nothing can be, construed as strange or inappropriate. So that's kind of a side note, but still got to think about it. Make sure that you always have a systematic approach. I tend to work from the floor up. I start with the feet. You put the feet in the right spot, and everything else from there can go where it wants. So whether it's feet up or you put the nose in the right position and see where it goes from there, that's fine as well. But you want to make sure that it's systematic. So put something in the correct spot on the plumb line or whenever your assessment is. And don't just start looking at random things. Start at the feet and work up, or start at the head and work down. You also want to make sure that you always compare bilaterally. So looking at both sides together, how do they work together? And whenever possible, you want to be at eye level. So that would be squatting down for you. And there's a lot of times you're also going to be palpating bony structures. So especially like the ASIS or the tibial tuberosities, things that you can't necessarily see overly easily through the skin, you can actually palpate them, and then you can see the heights of your fingers and are they normal or not. Alright, we'll stop there, and then we'll finish this all up with one more PowerPoint or one more lecture.